It is important that patients new to PD are discharged from the renal unit with enough knowledge to care for themselves safely on dialysis. And with that, first, a PD nurse should have an appropriate education and training to develop this vast knowledge base and practical skills to achieve high standard of care. The rationales of this video are that the learner will be able to demonstrate knowledge of the theory and skills related to the nursing care of the patient receiving PD, particularly to the patients who have Swan neck catheter. By using SMART learning goals, after creating this video, the learner will be able to discuss the Swan neck catheter, materials made of, the advantages and disadvantages of using it, to understand the criteria for choosing the Swan neck catheter, to illustrate the pre-insertion preparation of the patient, to describe the pre- and post-operative care of the patient, identify best practice for the long-term catheter care of the exit site, and lastly, identify the patient's point of view about PD. The Swan neck catheter are sometimes called the peritoneal catheter. It is a modified version of a lower abdominal catheter, which allows for an exit site on the upper chest. Has two segments that point downward. It is preformed of 150 to 180 degrees bend, and it is available in straight and curled. These are the different kinds of Swan neck catheter. It is available in Missouri, thin cuff, peritoneal, curl, and also Toronto Western. The catheter materials is made of kink-resistant silicone that is comfortable for the patient. The rationales for using it reduces the skin abrasion of the exit point, lessens the risk of intestinal or organ damage during insertion and use. Since there is less movement of the chest wall position than in the abdomen region, which leads to faster healing and there is a lower chance of side trauma. It has an intercut segment that is permanently bent. This design is appropriate for obese patients with multiple abdominal folds. Patients with ostomies or incontinence can benefit from it. Since it is typically kept out of bath water, it is utilized for patients who like to bathe. The advantages is that patients with dexterity issues can benefit from it. It can be customized for patients, allowing for an upper abdominal or pre-external exit site. Patients that have active lifestyles benefit from it the most. It has reduced the risk of infection at the exit site. It is a suitable catheter option for obese individuals, those who have ostomies or incontinence, and those who have struggled to manage a catheter at the belt line. The disadvantages are it must be surgically inserted. The dialysis solution flows more slowly through it. And because the disconnection in the channel poses a risk to safety, especially for growing children, and there is a higher chance of bacterial colonization of the catheter during an incident of peritonitis. The pre-insertion preparation of Swan neck are to have a complete pre-operative assessment for presence of hernias, to consider repair during PD catheter insertion or before insertion. The patient's lifestyle habits and work should be assessed and assess the catheter exit site. The location should be determined while the patient is sitting or standing comfortably. When the patient is lying supine in the operating room, the panos falls onto the side, making it difficult to identify the correct location for the exit site. It should be above the belt line. It is best to stay away from the skin folds and abdominal scars. Proper placement of the exit site is particularly important for obese individuals. It should be visible to the patient to perform daily exit site care and should not be buried under the panos to prevent recurrent exit site infections. It is important that the tip of the catheter be in the deep pelvis. This ensures optimal hydraulic function of the catheter and minimizes the risk for omental entrapment. Preoperative care of Swan neck catheter. The patient needs to take a shower or a bath to reduce the number of germs on the skin. Bowel preparations using Colite or PEG. The key is for catheter function post-insertion. Prophylactic antibiotics prior to PD catheter insertion, usually 1 hour prior to insertion. Monitoring laboratory values such as CBC and INR, and holding blood thinners prior to procedure as per hospital guidelines. Screening for Staphylococcus aureus, patient's psychological preparation, and the postoperative care are that the goals are to immobilize the catheter to prevent trauma to the exit site and traction on the cuffs, to reduce the possibility of bacterial colonization of the exit and the tunnel during the initial healing process, to prevent leakage to reduce intra-abdominal pressure. The postoperative care is that generally we wait for about 2 weeks from the time of placement of the PD catheter before first using it for peritoneal dialysis. This is done to allow the catheter tunnel to heal and minimize the risk of leak. However, if necessary, PD can be commenced on the same day as the catheter is placed, and in appropriate cases will minimize the need for temporary HD. The catheter tubing needs to be immobilized to prevent trauma to the exit site or traction on the cuffs. To provide detailed instructions on how to care for the catheter at home, and coughing, constipation, straining, bending over, and crouching should all be avoided since they raise intra-abdominal pressure. The long-term care of the exit site is that encourage the full treatment participation is the goal of this. Before performing exit site care, the patient should wash hands. Protocols for cleaning catheter exit site will depend on the facility. A mild non-irritant agent should be used to clean the exit site and surrounding skin. Puricin and gentamicin cream may be applied for prophylaxis. Should always clean in a clockwise direction. Immobilize the catheter, being able to recognize and evaluate the signs and symptoms of infection. Most point of view of PD patients is about body image disturbance. Dissatisfaction with the body is accompanied by social anxiety, shame, depression, decreased self-efficacy, and reduced quality of life. People in renal failure may experience negative reactions to their body because of the invasive nature of treatment. Nurses, by utilizing their listening and counseling skills, can help patients come to terms with these feelings and thus raise self-esteem. Healthcare team members working with this group of patients should be aware of this important issue and conduct psychological programs to decrease the level of body image disturbance. Thank you for watching my videos regarding Swan catheters.